I'm going to go ahead and begin. I'd like to welcome everyone and thank you for joining us tonight for our current webinar on the effects of extreme weather events on child mood and behavior. Our presenter is Dr. Jennifer Barkin, who comes to us from Macon, Georgia. She is Vice Chair and Associate Professor of Community Medicine and an Associate Professor of OBGYN and the Director of the Academic Health Department at Mercer University School of Medicine. And she's developed some tools for looking at these impacts on mood and behavior. And I think we'll hear a little bit about the development and use of that tool. Tonight's presentation is a collaboration between New Hampshire Healthcare Workers for Climate Action and the New Hampshire chapter of the American Academy of Pediatrics, the New Hampshire Psychiatric Society, the New Hampshire Psychological Association, and the New Hampshire chapter of the National Association of Social Workers. And we thank them all for participating and supporting tonight's presentation. I'll ask you to put questions that you have along the way of the presentation into the chat rather than interrupting the presentation, and we'll address them afterwards. Dr. Barkin's presentation will last more or less 30 minutes, and that'll be followed by about 30 minutes of question and answers and discussion. And with that, I'll turn it over to you, Jen.
Thank you very much. I really appreciate the opportunity to kind of spotlight this research. I know that you've probably all noticed that mental health is becoming much more popular topic related to climate. And, we're all here because we have an interest in kind of tying climate to health and I think in the general public, that connection is not totally clear just yet, but I think we're getting better. Maybe you would agree or disagree. I wanted to kind of tell you a little more about my background so that the presentation makes sense and how I kind of got here, if that's not too boring for you. So I did all my training in Pittsburgh. I have a statistics degree and a biostat master's degree and a PhD in psychiatric epidemiology. I also did a postdoc at Western Psychiatric Institute and Clinic. So I'm not a treating clinician. I'm an epidemiologist. It's so funny how I end up, not you guys, but I can't tell you how many panels I end up on, because I think as I'm in a medical school too, that I get questions about like patient care, and it's funny. It never ceases to amaze me, but I am an epidemiologist. I work a lot with psychiatrists, licensed counselors, marriage and family therapists, and OBGYNs, kind of across the board. I work with physicians, nurses every day, but my focus is mental health, and actually it's in the perinatal population. So I'll tell you a little bit about how I got there, and then I got from perinatal to child and how that all relates. So when I was looking for a dissertation topic, and this kind of ties in the tool development also, I wanted something in the psychiatric area. So my boss at the time introduced me to a pretty famous reproductive psychiatrist named Kathy Wisner, she's at Northwestern now, but she is a psychiatrist. And so she mentioned to me that in terms of mothers, that we really needed a tool that assesses functioning in the postpartum period. And kind of the reasoning was, well, we have several tools to assess postpartum depression, but when women come in and they present for treatment, they don't say, hey, my goal is to get a better score on the Edinburgh postnatal depression scale. Their goal is to function better in the context of motherhood and all the other roles that they're juggling. So I kind of went on this journey with her. It took about 2 years to develop the tool. It's called the Barkin Index of Maternal Functioning. And what it does is it assesses how women are kind of juggling their multiple roles whilst trying to take care of themselves in that first 12 months, although to be honest, a lot of it is caregiver, general caregiver concepts. So it could be pushed out, I think, even almost to age 2. The one thing that makes it kind of specific is the tie into breastfeeding. But so that kind of put me, since then, I have done a lot in the area of maternal functioning. So people take the tool, they'll test it on test it on mothers, and there's a lot of international use right now too. And sometimes they'll come to me and say, can we collaborate? I'd be interested in how you interpret this data. Sometimes if it's a really, advanced research school, they don't need my collaboration. The thing that really kind of gave me a lot of notoriety was that the tool, and we did not expect this at all, ended up being picked up in the clinical trials for a drug called, the generic name was brexanolone, and it's now Zulresso, but it's a FDA breakthrough therapy for postpartum depression specifically. So that was not expected. So it ended up being licensed in this whole series of clinical trials. So what I do is I work with groups that are interested in maternal child research to implement the tool, sometimes translate the tool in groups of different mothers. It's seeing a lot of use in the Middle East right now. And I also know a lot about just in general perinatal mood and anxiety disorders. So for a long time, we thought of perinatal mental health as postpartum depression. But since then, there's a greater awareness that that's not the only mood symptom or state. Anxiety is every bit as prevalent. And actually, anecdotally, if you talk to pediatricians and OBGYNs and say, what do you think you see more of in your perinatal population? They'll say anxiety most of the time. So with all that said, one of my recent ventures was I was on the board of directors for Postpartum Support International Georgia chapter. It's a really well-established global organization that is all about supporting new mothers, new fathers, and families in that first year after childbirth. So as we're kind of going, and the Georgia chapter is absolutely amazing. They're a pretty young chapter, but really ambitious. They did some amazing things in the first few years. My role on the board initially was corporate fundraising. So as we're talking about, our initiatives, there's support for military moms, there's support for Black mothers, minority, all different types. And I kept saying, we need to start to integrate climate change into our agenda. And I got literally completely blank stares because, again, this whole connection to mental health, human health, I think it's very recent. It's growing, but I still think it's a little bit focused in the healthcare sector. So anyway, I kind of pushed for that, didn't make too much headway at the time. But the other thing that was kind of happening that made me interested in how mental health in both mothers and children was impacted by climate was in Georgia, we had a summer maybe a couple of years ago that it was just incredibly hot, miserably in like May. And my son, I have a son and a daughter. My son is 10, my daughter's 8, was going out for recess. And then he would come back and say, it happened for about a week. He'd say, like, Mom, I don't feel good when I'm outside. And so, I started digging in on what that meant. And I started looking into, air pollution, asthma, how heat, the interplay between heat, air pollution, asthma, all of it. And, I think too, the thing I like about what we're looking at right now is not just children, we're looking at mothers too, is that the mother is kind of like the watchdog of the family health. My husband's great. He's great with the kids, but I'm the one that's kind of real sensitive and aware of doctor's appointments and dentist appointments. And so when my son is saying, I don't feel good, I'm paying attention. I'm also noticing that they have a kind of a heightened awareness and anxiety. My son will say, Mom, what if all the bees die? What will happen? How can we live? He's intelligent. He's asking these questions, and it causes anxiety. So I decided to kind of build a new line of research that is already, it's in the realm of perinatal mental health, where we're looking at both children and mothers and how these extreme weather events, different types, impact mental health. So that's kind of the background for how this particular study came about, but I may go back and forth kind of comparing the child and mom literature while we're talking about this, because we just finished a study. So I have kind of context on how it affects children and the mothers. And I will just say right off the bat, the child studies there's more of them. They're more varied. It's just a richer literature database, and that totally makes sense because of a whole bunch of reasons that I'll get into. But so that's kind of how I went from, looking at perinatal mood and anxiety disorders into climate anxiety, perinatal mental health, and child mental health. So this particular study, this was our first publication on climate specifically, integrating it into like the kind of the mental health scene. And it's a narrative review, and I don't want to make assumptions about what people know or don't know. It's not a systematic review. It's a narrative review, which is kind of almost more like, a snapshot of the literature at, any given point, and you're not putting real specific parameters on the rigor of the study. So it doesn't have to be, a clinical trial. And that makes sense because where the climate literature is right now, it's not mature enough, right? We don't have, it's not like a cardiology where there's oodles of data. So anyway, the narrative review is almost, I like to think of it as telling the story in a snapshot in time, where while your search terms might be specific, the parameters around the rigor of the design of the study are not really stringent. But nonetheless, super important. So I feel like I'm kind of preaching to the choir. We all know that these extreme weather events are more intense, harder to predict. We just had the tornado that whips through several states, and it has impacts across the board. Again, we're all working towards the public making the connection between extreme weather and climate and human health. But, injury, illness, death, and displacement, they all affect mental health also. And probably, I'm sure a lot of you know that children, women and children, so really the mother-child dyad, are a vulnerable population. And there's there's evidence in both the child and maternal literature, because I think you really have to look at them both together to really get the whole picture. There's evidence of negative mood symptoms, developmental delays, depending on the situation, the event. So what we did that I think was a little bit different in this study was, if you look at the literature in this area, and also it applies to the moms too, you see a lot of studies on one singular event. So like there's a ton on Hurricane Katrina. And the maternal literature, the big criticism there is a lot of the studies are from two events, from Project Ice Storm and from a flood study. So, you're not getting the variety. But the child literature is actually rich enough that we were able to synthesize the literature across a whole bunch of different types of EWEs, extreme weather events. So kind of the way I thought of the question was, if you had to look right now and tell the story of how extreme weather impacts child mental health, what would the major themes be? And when I say extreme weather, I mean across different types of events, wildfires, cyclones, heat, etc. So, it was pretty standard in the way we did it. We looked, our search terms were mental health related. We put all the different extreme weather events in the search term, so it would be inclusive. And we looked at children only. We canvassed the databases for articles published over the past 10 years. And we used kind of all the usual suspects of databases, PubMed, Embase, Web of Science, and PsycInfo. So what we ended up with, according to that criteria, was about 70 plus articles. So again, better than the maternal mental health climate area, but still pretty young, still pretty new. That's not a huge number. So what we ended up finding, and I went through this over and over and over again, looking at the articles, thinking, how can I tell like a comprehensive, but comprehensive yet concise story about what's going on in this particular area? And the major themes, when I looked through the stack of papers over and over and over again, that I found were a lot of information about, well, what was the range of psychological symptoms and behaviors across all these EWEs in the child population. And then, second was, what's the potential for long-term effects? Is it, an acute situation, or is it more often persistent and long-term? And then as an epidemiologist, you always think in terms of what are the protective factors and what are the risk factors. So if you think about recovery, child recovery from a extreme weather event, the trauma incurred from an extreme weather event, what factors are going to support quicker and more complete recovery, and what factors are going to impede it? And then finally, implications for screening and treatment. And I'll just tell you, this was not my focus of this paper, but the more I look at the psychological symptoms in both moms and kids, the more I'm finding out about what the current state of screening and treatment are for climate trauma. So what did we find? Again, the thing that was so striking in looking at the child literature and then following it up with the pregnant and postpartum literature was that the moms, the range of psychological symptoms was much more narrow. Like we saw a lot about maternal stress related to climate events. With children, there's just, it's a richer knowledge base. There's more outcomes that have been studied across more different types of EWEs. So, and I just want to sort of make a note about that. And I have 2 kids myself, so this is nothing against kids, but in perinatal mental health, reproductive psychiatry, one thing that's always said is like the mom's the wrapper and the baby is the candy. And you take the wrapper off, the wrapper gets thrown away and the baby's the candy. So it's kind of, the baby's the important part. That's the way society is kind of geared. And that's a big criticism against our healthcare system, is that if you think about it, a mom can have a C-section and have one follow-up visit, and it's very focused on kind of the clinical, the birth outcomes, any pregnancy complications, C-section scar, but it's not framed as a major life event. Now more and more pediatricians and OBGYNs are screening for perinatal depression. But I have to say, what I saw in the child mental health versus perinatal mental health literature, it kind of corroborated that assumption. The kids are definitely more of the focus, which is interesting because while they need someone to stick up for them, just because developmentally they can't always do it for themselves, when we need to understand how it affects them, the mom is real important, because in general, just like I noticed that my kid was after recess was not feeling well, and generally, regardless of whether the mom's a working mom or whatever the setup of the household is, the mom is usually kind of the watchdog of family health. I'm the one nagging my husband to go get his physical. So what types of psychological symptoms and behavior were present in the literature for children? Post-traumatic stress, huge, we all know that. 71% on average of children that go through this experience some type of post-traumatic stress. Elevated rates of depression, anxiety is often comorbid. All 3 of them can come together. Negative externalizing behavior, so like kind of acting out, delinquency. There was an impressive range of, now I say that there's several on even linking it to substance abuse later in life if you were exposed to an extreme weather event in childhood. Now, not all of those outcomes have been replicated in multiple studies, but there is a nice range of outcomes that are considered on the whole. So delinquency, all of these things, attachment insecurity, substance abuse, academic performance, sleep disturbance, not too many studies on that, but there's some hints of it. Diminished earning potential as an adult, impaired functioning, suicidal ideation. So all of these negative outcomes, you couldn't call them anything but negative outcomes, have been linked to childhood exposure to extreme weather events. So then one thing I was really interested in is kind of recovery trajectory. What does recovery look like? And honestly, a lot of these concepts, it's, so extreme weather, if your exposure is serious enough, your loss is serious enough, it's a trauma, right? That's considered a traumatic event. And they're just like, a sexual abuse or, I don't know, a community violence, et cetera, et cetera. So a lot of these concepts are just general mental health concepts that completely make sense. Even if you're not looking at extreme weather, you're looking at some other type of trauma. So multiple studies indicated that there's a strong potential for long-term mental health effects. So it is completely within the realm of possibility. However, what you have to consider is chronicity. So are you in an area, that had a one-off event, or have there been multiple floods to the point that the community, the parents can't bounce back? So that is a major driver. The other thing that you will see through both the child and the maternal mental health literature as it applies to climate, extreme weather event exposure is level of exposure or degree of loss. Those terms are pretty similar. So you lost your home, you need to relocate, someone was injured. We've seen reports of, pregnant women, they have to, changing their healthcare network. So you're in the middle of pregnancy, maybe you like your OBGYN, but you have to move. So all of those types of things are considered kind of loss, or, they kind of dictate how you would characterize a range of exposure. Were you walking through the floodwaters? Were you inhaling the wildfire smoke? How serious and extreme was your exposure, and what was your level of loss? And that can be economic, health, social support networks, et cetera. So again, I would say if you had the two strongest in terms of recovery trajectory themes that were associated with negative health outcomes, or how frequent, the chronicity of the event and the level of exposure / degree of loss. So protective factors. And again, like I said, a lot of these could be applied to different types of trauma. It doesn't necessarily have to be extreme weather. It all kind of makes sense. What is someone's level of how sophisticated are their coping skills? Do they have adequate social support? And I always think of social support as, we always think about replication in epidemiology. So, can you establish causality, which usually it's pretty hard to do. And you need kind of replication over time. So we know, for example, that smoking is associated with, strongly associated with a whole array of negative health outcomes. Social support, and I always say there's just very few factors that you can, like cigarette smoking, that are, you can almost say this causes, even though there's some argument over that, they're so strongly and so consistently associated with an outcome across studies, across ages. I always think social support is that for mental health. Social support, more social support, and the quality of social support and the type. Is it the husband? Is it the mother? It is almost always a protective factor. Caregiver emotional support, the parent, the quality of the parent-child relationship, the ability to have growth. So reframe the event as something positive, which is hard to imagine with a hurricane or losing your losing your home, but, to kind of, I don't know, invert it or turn it upside down into something good that you could grow from. Positive reappraisal, positive positional mindfulness, household air conditioning, green space, which we already know green space has multiple benefits, physiological benefits. On the other side, the risk factors were older age on the whole, and I'm going to say on the whole because there may have been a study or two where the association was flipped, but in general, older age, female gender, having intrusive rumination versus deliberate rumination. So, you're almost like having flashbacks. They're intrusive. You're not deliberately trying to work through the event. You're having intrusive thoughts. And the degree of disaster-related loss. Losing your home, services, resources, your kid's school shut down for a couple of months, healthcare network, social network, friends, injury, all of those things. And a lot of that is driven by displacement, which is becoming more and more common. The thing about the female gender that was so striking and interesting, though, is a risk factor. And that association was seen a bunch of times, that women, children, females, because you see this on the mom side of it too, were more, they were more predisposed to depression and anxiety related to climate events. But the interesting thing was, on the flip side, female gender was also associated with a sort of a increased capacity for post-traumatic growth. So, you're feeling the symptoms maybe more often or more acutely. On the flip side, maybe there's something with women having the ability to adjust faster. I can't explain it, but it came up several times in the literature. Oh, so these are additional risk factors. And again, these risk factors, you could take these risk factors and put them in almost any kind of traumatic situation. If someone has, strained resources financially, they've had an injury, they've had an exposure to violence, they don't have a good social support, they've had negative life events, so like a cumulative toxic stress throughout their life related to some other event, that would predispose you to a more complicated recovery path, if there is recovery, or more negative events later on in life. Again, this is totally flush with the rest of the mental health literature, even outside of climate. So in terms of implications for screening and treatment, while there's a very large, the majority of children report post-traumatic symptoms in the aftermath, only 5 to 33% actually access counseling. And this, being in this field in general in mental health, doesn't surprise me at all. And there's some specific barriers related to this type of situation. If you think about, if you lost your home and you were trying to relocate your children and their schooling was disrupted and your utilities were an issue, the mental health part takes the back seat because there are more immediate needs. So that kind of gets shoved off. And a situation where there's kind of a chronic exposure to extreme weather, the communities are consumed with recovery of basic resources. So again, mental health takes the back seat. And what I think is kind of resultant of the situation of, having an extreme weather event and potentially displacing you, is that when you look at the kind of the therapies that are mentioned, a lot of it is complementary and alternative medicine. So it's like self-care, yoga, journaling, mindfulness exercises, meditation. And I think it's just a convenience thing. I think it's been looked at more because you can do it on your own time. You don't need, I don't know if any of you have had to secure any kind of counseling services for anyone, but it can be surprisingly difficult, even if you're in a city. Child counseling. I have a friend who has a child that's autistic, and she's, having a really challenging time finding the right type of support. So, you can imagine that if you have these basic needs, that becomes the focus. And the mental health takes the back seat, and things that are easy to do, you might do for yourself, or you might recommend to your child because it's free and it's feasible, basically. But the few published reports that there are indicate value in both screening and treatment and satisfaction when it's done for both parents and children. So kind of the wrap up here is, we know that extreme weather is more severe and frequent. Children and mothers are disproportionately affected. Physical and mental health can potentially be affected. There are mental health ramifications, and they can be long-term depending on the specifics of the event. There are risk and protective factors that combine with exposure level or degree of loss to influence the recovery trajectory. Significant work remains in the area of post-disaster assessment and intervention. And honestly, this is what you see all through mental health. There's just, in so many areas, there is lacking mental health infrastructure. I mean, if you're in a rural area, good luck. It's very difficult to find. And do they accept insurance? So that's kind of what I would say is the general wrap up. And the thing that I always notice is as researchers, when we write these papers up, there's always this conclusion section, and we're always kind of giving primary care physicians more things to do. They need to check for women's mental health, and they need to check for all the social determinants and the environment. And I think to myself, I think about when I had my son and what my OBGYN's kind of waiting room looked like. I even as I'm writing it, I think to myself, this is kind of unrealistic. You have to look for specific clinical parameters and outcomes, and we're putting this whole other area on their plate. But in some areas, the PCP is kind of the whole deal for the family. There might be one practice in a rural area. Now, cities are a different story. Atlanta is so much more resource than a mid-sized city versus a rural area. It's not even, on the same scale. And I'm sure that's true in almost every state. The cities are the hubs for just about anything, and subspecialties too. So, one thing that I deal with is that I get people that'll call me and say, hey, my friend is pregnant, or she's in the postpartum and she's depressed. Is there anyone in Macon to talk to? But she wants to see a woman, and she wants to see a mother. And so those kind of specialty niche areas, it's challenging. So, and I think about how the recommendations that we have for primary care providers, and they're supposed to screen for perinatal depression and anxiety. And, I don't know what the current screening rates are, but as of a few years ago, they were kind of low and inconsistent. And I think it's just, I testified before the Georgia House of Representatives on a similar topic. And one of the OBGYNs on the panel said to me, well, would you ask a psychiatrist to deliver a baby? And I thought, yeah, I mean, it's true. We do lay a lot at the feet of our healthcare workers. So that's my 35 minutes.